So back pain is less, but knee pain is still there.
Okay. Is it keeping you from doing anything at home or outside of home?
अब यस्तो घरभित्र कामहरू गर्न घरको बाहिरको कामहरू गर्न तपाईँलाई गाह्रो हुन्छ यसले गर्दा. I think interpreter is like a bridge, like for two countries.
You're trying to bring two cultures together, and so that's what our interpreters do. Try to bring the practitioners and their patients together.
It's like learning new things each and every day, then like meeting different people, not only just the foreigners practitioners, but even our local people. And the best thing about is like their stories, how they came to this place and how far they have to walk, and even like when they talk about their buffaloes, cows, their worries about how to feed them. It's always been interesting to hear about that.
I can tell how much they care about the patients as well, and they make them feel at home. They love to crack jokes and make them like put a smile on anybody's face.
We have a training with the teaching sir. So at first, for a month, we learn about the more vocabulary in medical term. I learned so many things.
So actually, we struggle a lot, like doing a practicing like a medical terminology. So before it was a little hard, but we managed the times.
They're not just translating the language, they're interpreting the meaning of the language, because the meaning for us is different than the meaning for the local people. So it's important for them to really understand what the doctors are saying so they know the right way to interpret it.
So every week we get the trainings from practitioners about this, like different, like sometimes anatomy and sometimes with the different diseases, and so it's been very much helpful.
Some of our senior interpreters now are capable of taking vitals, pulling out the needles. Since they have worked with the patients many times, they are aware of the patient care that our practitioners provide. So they are always vigilant of anything is going to happen.
When I'm interpreting, I'm learning new English words and also Nepali words, and that is interesting for me.
I've worked with interpreters before in the States in a medical situation, and these interpreters are top-notch. It's very clear that what I'm communicating is being communicated to the patient. Well, because these interpreters have been working with Acupuncture Relief Project for so long, they have an expert view of an acupuncture practice. I often ask them, do you know what point this is? Do you know what meridian this is? Do you know why I'm doing this thing? And pretty much 9 out of 10 times they're spot on. Because the education level that they've gotten just observing practitioners for so many years, and also the classes that ARP is giving them.
They're constantly looking to have an understanding of what is actually happening with the patient, and also why did the practitioner treat the patient in this particular way. So they're definitely hungry for knowledge and are interested and engaged with our patients and with our practitioners.
It's improving their English so much that it's opening job possibilities just because of that. But more so, they're getting medical training, and they're getting insight into the medical field to decide if it's something that they want to pursue.
Since the Acupuncture Relief Project came to our village, I just got interested and I asked Andrew and other practitioners, teach me some, and then since then I started, so it's been a while, like 4 or 5 years.
I know that there's at least 3 of the interpreters who want to apply to go to the acupuncture school in Kathmandu, and that's pretty exciting.
For the professional worker, they need to be certificate level, so I have to go to school to get the certificate and then all paperwork. So after graduate, like I plan to work with Acupuncture Relief Project.
I see myself like being a part of it for a long time, because I love this project, so I would love to stick with this project for a long time.